Welcome back, everyone. Today we're talking about true and irreversible gum line sensitivity, something that Sensodyne can't fix. You're trying to enjoy a glass of cold water, and as soon as the water hits that tooth, that particular tooth, you might as well just go to the torture chamber. Or when you're trying to brush your teeth at night, and despite your best attempts to avoid that tooth, the pain comes. Now, fortunately, there is a procedure your dentist can do to fix these type of problems for good. I'm going to use my surgical operating microscope to show you guys what's involved in this procedure. And then the next time you're at your dentist's office, you can ask him or her about it. Sometimes you can develop this tiny little divot at the gum line that will drive you crazy when either cold water or a toothbrush hits it. One way for us to fix this problem is to actually abrade the area and any associated decalcification with a diamond. Once that's done, we need to make sure that there's no decay underneath. In this case, there actually was some decay under the surface. Then we use a special metal band that adapts right around the tooth. The whole purpose of this is to make sure we have an excellent seal all the way around so that no moisture gets underneath our filling. Then we go through our bonding process. I have other videos that cover this whole process in more detail, so check those out if you'd like. Once we're bonded, we're ready to put the filling in. Because it's such a small filling, I actually am using a flowable composite resin as opposed to the normal packable stuff. What that means is that the filling goes in like a fluid as opposed to a paste. We build it up bit by bit just to make sure that the material doesn't shrink too much when it's getting set by the light. Here's our third increment going in, and we cure it. Once we've done that, we take it off the band and trim it back to size. Now, don't be alarmed, but there's quite a bit of bleeding when we trim these gum line fillings back. You have to keep in mind that the gums are going to heal, but a bad filling will not. We check for smoothness, and now we have a well-insulated area at the gum line to prevent that cold and brushing sensitivity. There you have it, folks. That is how we fix gum line sensitivity, or at least one way that we can. There's a lot of different ways to skin a cat in dentistry, and every dentist may give you a little bit of a different opinion on how is the best way to fix your problem. But now you know that if there's a little notch at your gum line and it's driving you crazy every time you touch it with a toothbrush or when cold water hits it, then you can at least talk to your dentist about doing something like this, and maybe you'll be in peace, finally. I'm excited for you. Anyways, thanks so much for watching. If you like this video, make sure to subscribe because that will make me love you forever. And that's all I have to say. I'll see you in the next video.